Wow. Crazy. You're crazy, girl.
Okay, I guess we're doing this. There are things that can be done to actually reduce the risk of dementia instead of making yourself look like a pink bird and using a non-dominant hand to do mundane activities. If you use your non-dominant hand, you're supposed to stimulate neuronal pathways that you haven't used before, and that can reduce the risk of developing dementia. None of that stuff is really based on evidence. But you know what's hilarious? In that video, the thing that she's doing that will reduce the risk of developing dementia is brushing teeth. Good oral hygiene to reduce the risk of gum disease will actually reduce the risk of developing dementia. Proper exercise, making sure that you get good social engagement, actually having friends and having a good social life will reduce the risk of developing dementia, and actually having good sleep. All those things have been linked to reducing the risk of developing dementia. But you know what? That stress thing might actually be true. Apparently, there's some loose literature that says that standing on one foot makes you focus on that one specific activity. You're trying to just maintain your balance the whole time, that it's more of a mindfulness activity, because at that point, you're so hyper-focused on that one task that it helps reduce the background noise in the back of your mind, and I guess it can reduce anxiety. Do the things that I said. That is all science-based. That is all evidence-based. All those things will reduce the risk of developing dementia.